This program is for informational purposes and is to be used along with the instructions provided by your physician. Your doctor prescribed a metered dose inhaler and a spacer device for your child to use. It is important to know how to use your medicine the correct way. A spacer is a special device to use with your child's inhaler. Spacers increase the amount of medicine that goes into your child's lungs. This can help your child's medicine work more effectively and in turn help you manage your child's asthma better. Better asthma control can also mean less frequent use of your fast-acting rescue inhaler and less frequent hospital trips. The spacer has 3 parts: an adapter, the chamber, and a mouthpiece or mask. The elastic adapter at the back of the chamber allows patients to use inhalers of varying sizes with their spacer. The elastic adapter should form a good seal around the mouth of the inhaler. If you find you do not have a good seal, let your doctor or pharmacist know. A different spacer may be more effective for your inhaler. Next is the anti-static chamber, where the medicine flows within the spacer. Medicine stops at the valve that opens when your child takes a deep breath through the mouthpiece. Younger children will need a mask attached to the mouthpiece of the spacer. Older children may be able to use the spacer without the mask. Let's learn how to use your spacer. Step 1. The first step is to remove the caps from both your inhaler and your spacer. Look inside both to make sure you do not see any foreign objects. Step 2. Prime your inhaler if it is the first time you are using it, or if you have not used it for over 14 days. Each type of inhaler is different. It is important to read the information leaflet that comes with your inhaler. We recommend you shake and spray the inhaler 2 to 4 times away from your child's face. The action of priming is important to ensure your child gets the right amount of medicine per dose. Step 3. Attach the mouthpiece of the inhaler to the elastic adapter at the back of your spacer, then attach the mask if the child needs that piece. Step 4. Shake the inhaler so the medicine mixes with the propellant. If you do not shake the inhaler, you will get more propellant than medicine when you inhale. Step 5. Have your child force all of their old air out. Have your child wrap their lips around the mouthpiece without biting down. Squeeze the inhaler top to puff, and have your child take 1 slow, deep breath and hold for a count of 10. Then, take 2 to 4 more good deep breaths to finish emptying the spacer. Take the spacer away from your child's mouth and wait 1 minute between puffs, then repeat the process. Inhaler technique with spacer and mask. Shake the inhaler to mix the medication and propellant. Put the mask over your child's mouth. Spray the medication. Allow your child to take 6 to 10 good deep breaths. In infants and small children, you will be able to see their rib cage or stomach move with each breath. Remove the inhaler and mask and wait 1 minute between puffs, then repeat the process. If you hear a whistling sound or the sound of a harmonica, your child may be inhaling from the spacer too fast. Assist your child in slowing down their breathing. After using the inhaler and spacer, replace the cap on both. Cleaning instructions. Wash your spacer once a week in lukewarm water with a small amount of mild detergent. Take apart the inhaler and mask. Agitate the inhaler and mask in soapy water for 1 minute. Soak for 10 minutes and do not scrub. Rinse the inhaler well and air dry in a vertical position. Do not dry using a cloth. Cloth drying can cause static within the spacer chamber. Static can make medicine stick to the sides of the chamber and you will not receive the full dose of medication. When the inhaler is dry, put the parts of the inhaler back together. Replace your spacer with a new one every 6 to 12 months. For more information, contact your pharmacist or the doctor who prescribed your child's inhaler.